Mental health has been on the forefront, and now more than ever during the COVID-19 pandemic. Due to the state and community shutdowns, individuals have become more isolated, and for many, it has increased their symptoms of depression, hopelessness, suicidal thoughts and behaviors, increased substance abuse, and increased cases of domestic violence. Suicidal behavior has increased even among healthcare workers and first responders, especially in the hardest hit areas of the pandemic. There are professionals who have been in the business of saving lives and have ended up feeling overwhelmed and defeated due to the great number of COVID deaths. There's been so much loss and grief reaction during this time. If we follow the stages of grief, which are shock, denial, bargaining, depression, and anger, these are what most of us have been feeling. We're all grieving over the loss of human life, the loss of financial security and livelihood, the loss of what's been safe and familiar. For some, even the loss of basic needs to survive. There's been a sense of loss of control over our lives as well, and our ability to protect our families. Finally, there is the last stage of acceptance. We can acknowledge that our feelings during this time are normal and begin to let go of expectations that we have to feel the way we used to and allow ourselves to begin to move forward. We all have different coping abilities. Some individuals are more challenged with regards to emotional strength. We all develop these based on events that we've been through in our lives. Before this pandemic was ever here, most of us were already facing normal and sometimes traumatic life circumstances.
How do we know that we are experiencing stress, anxiety, or depression? What are some signs that we can look for?
So here are some signs. We have to look for difficulty sleeping, whether or not we're having dreams about death and dying, increased forgetfulness, confusion, increased difficulty making decisions, increased difficulty with concentration, increased irritability with those around us, excessive worry, and feelings of hopelessness or suicidal thoughts.
So if anyone's experiencing these signs, what can be done to help?
Especially with regards to the pandemic, we have to manage how we consume information, making sure that the information is coming from legitimate sources. Also, it's helpful to limit our exposure to the news and conversation about the pandemic. It's important to continue practicing previous coping skills that we've already had, like exercise, movement, taking walks, listening to music, healthy eating, and keeping as much of your previous daily routine as possible, also limiting your consumption of alcohol. We should be staying connected with others, maintaining social networks like phone, email, and video calls. Maintain contact with your support system like your family and friends, and talk to someone you trust. Maintain your support through your recovery groups and social media like 12-step meetings through Zoom or online, and utilize self-help reading material if you have them. Maintain contact with your spiritual support system or church, and use prayer for spiritual strength. You might benefit from using online relaxation apps that can teach breathing exercises, meditation, and positive thinking. Pay attention to your children and other family members' mental health and be observant of their thoughts and behaviors. Check in with them. Your children will be observing their parents and will take their emotional cues from them. Instill hopeful thoughts with your family members and keep routines going. The schools have done an excellent job with maintaining some sense of normalcy through distance learning and maintaining contact with their students. Reach out to a mental health professional if you need to, and there have been mental health hotlines established throughout each state. NAMI, the National Association for Mental Illness, has a great resource online, as well as hotlines for substance abuse and suicide. As hospital employees, we may be experiencing a new level of stress or trauma in working with COVID patients. Sometimes our own personal environments are not as supportive as they could be, and we may have some sense of stress that our patients are also experiencing, making this time even more challenging for us and our family members.
Can you tell us about some resources we have here in behavioral health for employees?
Yes, at Singing River Behavioral Health, we are available for telehealth and face-to-face visits as needed with our medical providers and therapists. And our employees have access to 6 free visits for themselves and for each family member. Recently, in working with patients, it seems that the longer the isolation has gone on and the number of new infections and number of deaths increase, the more their mental health is being challenged. Plans for reopening the community has allowed for more hope. I tell them that this will pass, that this will not be forever, that their futures will still be there, although maybe a little differently than they had planned, and to stay hopeful.